So how long does dental anesthesia last? Well, first of all, let's clarify what I'm talking about in this video. When you go to the dentist to get a filling or a root canal or a crown or any other common procedure, your dentist will probably numb you up prior to that procedure. Now typically, this is done by injecting a local anesthetic into the gums. However, nicer and more gentle dentists and those that aren't in a huge hurry may rub some numbing cream or gel on your gums before injecting the anesthetic. Now this is one of the parts about dentistry that all people hate. It's no fun getting an injection, and it's usually the most uncomfortable part of the procedure. That first stab makes us all cringe a little bit. However, once the anesthetic is injected, it keeps us from feeling the dentist drilling on the tooth. So most of us are willing to get that anesthetic because it's better than feeling the procedure. Now, when you're done with a dental procedure, you usually will experience numbness in your lips and gums, and maybe in your cheek, and this can last for a little while after the procedure. Now, generally, this numbness is going to last somewhere between 2 and 5 hours before you begin to regain feeling in those areas. Now, sometimes it'll feel warm or tingly when the feeling starts coming back, and then everything's good to go in an hour or so, and then the feeling comes all the way back. The scary part of all this is that for some people, that feeling doesn't come back, and they start worrying that something may be wrong, as they should. Now, if you have a dental procedure done and you don't start to regain feeling within several hours, you may have suffered a nerve injury. And nerve injuries can occur as a result of dental malpractice. And these injuries are usually caused during root canals, extractions, and dental implant placement. The nerves we're concerned about here are the lingual nerve and the inferior alveolar nerve. The lingual nerve runs along the floor of the mouth and provides feeling to your tongue. The inferior alveolar nerve runs through the middle of your lower jaw and provides feelings to your gums, lower lip, cheek, and chin. Now, these nerves are at risk during some dental procedures, and injuries to the lingual nerve and the inferior alveolar nerve are a big reason that folks sue dentists. So, if your numbness isn't wearing off after a dental procedure, and if you're experiencing odd sensations or numbness in these areas, you should take this very seriously, because nerve damage can become permanent if you don't get treatment right away. In fact, the literature on this subject suggests that you need to address your nerve damage within 3 months to get the best results. And after 6 months, the nerve damage is much more likely to be permanent. In other words, the chances of having a successful outcome from a nerve repair surgery or some other intervention decreases significantly over time. Now, if it's only been a little while after your procedure, you may have nothing to worry about. The numbness may just go away, and you may just be getting a little bit paranoid. However, if you go to sleep and you wake up the next day and the numbness is still there, you should reach out to your dentist and let them know. In fact, the moment you think something's wrong is a great idea to talk to your dentist about it. When we're talking about nerve damage, it's definitely one of those situations where it's better to be safe than sorry. Well, that's all I have for you today. If you're concerned that you may have nerve damage as a result of a negligently performed dental procedure, please don't hesitate to reach out to us. Unfortunately, we see these types of cases far too often, and we understand how frustrating and scary it is for folks when they're stuck with a nerve injury. Just call us if you want to talk. We're happy to offer you a free legal consultation and talk with you about whatever you're dealing with. You can call us at 321-LAWSUIT, or you can look us up at www.spetsasbuist.com. That's SPETSASBUIST.com. And thank you so much for watching this video, and we'll see you next time.